Okay, welcome. I'm Dr. Andrew Cohen, and this is a video version of a podcast we just did. So we're going to sort of redo it. We're going to do it in video, and we might even update our podcast. But we're here to talk about the number one reason kids see a pediatrician, the number one reason they go to the emergency room, and the number one reason we administer antibiotics in this country, and that is ear infections. So we got a lot of kids having ear infections. The majority of kids will get ear infections when they're kids. And the majority of these kids will receive antibiotics. And is it appropriate? And is it safe? So these are important questions to ask since most of these kids are getting them. Most parents do not want to give their kids drugs. And yet most of the kids are getting drugs. So let's take a quick look at what's going on here. So we have maybe some fluid in the ear. We have an infection. The kid's in pain. Obviously, they're grabbing their ears. You know, you see your little baby in pain, and it is hard. As a parent, you never want to see your child uncomfortable. But yet, is it the best course of action to give these kids drugs? So let's take a look at ear infections. And what turns out is that the majority of these ear infections are of a viral nature. So now we have a math problem. The majority of these kids are getting antibiotics to treat the ear infection, but the majority of ear infections are of a viral nature where antibiotics are useless. So what's up with the math? Okay. So if we look closely at the math, what you see is something really the pediatricians need to take a closer look at and answer for themselves. It's really not for me to say. I could only guess that when a parent comes in and the child is really hurting, they don't want to let them down. They don't want to do nothing, even though the American Academy of Pediatrics says to watch and wait for the majority of these kids. So in other words, the body will heal itself. These kids will heal if you watch and wait and give the body a chance. They have an immune system, and their immune system can handle these things, and the body will take care of it. But yet, even though the recommendation is to watch and wait, and even though the majority of the ear infections are of viral nature, the majority of these kids are still getting ear infections. So now we have a problem. The problem is that we have antibiotic resistant diseases in this country, and they're getting tougher and tougher to treat, or they cannot be treated at all. And the main culprit is the fact that we've given out way too many antibiotics over the years. And what happens is, if you give it out when it's not appropriate, the little bugs that are stronger and survive, they make more babies of stronger and stronger bugs. And the next antibiotic batch may not be as effective, and on it goes to the point where these things evolve, and they evolve very quickly. And now we can't even take care of that. So as a pediatric chiropractor, you may be wondering why I'm even talking about this. But the fact is that it's very rare that you find children that are taken care of at birth, such as the sons and daughters of pediatric chiropractors and or people in our practice who even ever get an ear infection to begin with. So right there's a significant finding. But more importantly, these kids often can get well on their own and with the assistance of a chiropractor. We'll explain that in a minute. They do get well oftentimes without medication. So certainly that's a preferable option, I would think, than taking an antibiotic. And this is why, even though the antibiotics are very common and people rely on them and they just assume everything's all hunky-dory, there are side effects. And there's a big, long list of side effects. And the short list is the obvious, diarrhea, rash, high fever, all kinds of issues that can happen with an antibiotic. But even something as simple as amoxicillin, on occasion, they're little kids. They take it, and for whatever reason, their liver cannot process it, and they can go, into a situation where they die, and the liver shuts down and they die. And this is just from an antibiotic. Now, I'm not saying this to scare you, but I know a set of parents I've met personally who lost their little boy. And it was simply from an antibiotic. His liver started to shut down, and they couldn't help him in time. So any drug is serious, and we don't want to give it unnecessarily. And apparently, these drugs are being given inappropriately a fair amount of the times. So you have these kids with ear infections. Sometimes the antibiotic does help on the short term. It helps clear out the ear infection on the short term. It's treating the symptom. But it's not helping your body be stronger. It's not helping the child's body get stronger. It's not helping their immune system get stronger. It's just killing the bugs that it can in the moment. And what's very common, you could talk to any parent, and any parent listening to this can attest to this, is that oftentimes there's another ear infection to follow up the initial ear infection. And then there's another ear infection and another ear infection. So a lot of these kids have 2, 3, 4, and I've heard of kids with 6, 10, 12 ear infections, all before the age of 2 or 3. And what's common here is that different antibiotics are tried, steroids are used, and then these kids get sent in for surgery where they're put under general anesthesia, which once again, it has its own risks, and you wouldn't want to put your child under that unnecessarily. And then they get tubes in the ear where you have to actually cut the eardrum, stick these plastic tubes in there, and hope to dry out the fluid. So all of this is, to me, it seems quite extreme, although it is quite common, and people have sort of accepted this, and many parents are happy with it when they see the symptoms clear out, because once again, you do not want to see your child suffer. So the pediatricians, and they're really doing the best they can with what they have to offer, but maybe there's something else that can be done. So without treating an infectious disease, or without treating the ears, or even touching the ears, pediatric chiropractors have been really successful helping the little bodies, little boys and girls, get their body functioning correctly so that they don't get these ear infections in the first place, or that they do clear out. The body takes care of itself once they get adjusted. So for those of you not familiar with this, you might be wondering, well, why would a child get adjusted? You might only think of back pain or neck pain to see a chiropractor, but that's really has very little to do with chiropractic at all. So what happens is that many of these kids have damage at birth. They have damage to their spines. They have misalignments of the bones of their neck, and it starts to affect the functioning of their nerves. So this is what a chiropractic is concerned about, is the functioning of your body depends on the healthy functioning of your nervous system. And if the neck is damaged, as it often is at birth, even if you have the 9.9 APGAR score, there can be damage there. And we are able to correct this. So the damage to the nerves will affect your immune system. It can create inflammation in the body. And the subluxation, what we call the subluxation, or the misalignment and the fixation of the bones of the neck, especially the upper neck, can limit and affect the drainage, the lymphatic drainage, which drains the middle ear. So chiropractic helps in so many ways. So the fluid, first of all, if they're checked from birth, the fluid never really even gets a chance to build up for a lot of these kids, because the drainage system, the pipes are clear, and the immune system functions so much better because their nervous system doesn't have a chance to build up tension and irritation, because that early damage is cleared out and it's kept clear through periodic checkups. So chiropractic, and pediatric chiropractic specifically, can do this, and the adjustments are awesome because, with babies and, basically with babies, often they sleep right through the adjustment, and kids do awesome with these adjustments. They literally run into the room, they're happy to get them, and there's no side effects, and it doesn't hurt them in any way. So with the gentlest touch and with specific training, which we do, we take extensive training at this, is that we can help these kids. And basically all we're doing is helping their body function well by making sure their nervous system functions well, and making sure we correct any damage that occurs either from the birth process or the early stages in life when kids are learning to walk and they fall and they bang their heads and that kind of thing. So we have tremendous success in our practice with these kids with ear infections. We're not treating the ear infections. We're not touching the ears or putting anything in the ears. We are correcting the nerve irritation and disturbance via a chiropractic service, which is the adjustment. It's totally gentle, and kids love it, and parents love it, because now their kids are not taking these drugs. They're not taking the risk of any side effects, and their child is not only getting well, but they're staying well. And on top of that, we have these same kids who often have multiple other problems. The parents are seeing them sleep through the night. They're not having the reflux and colic like they were. Some of these kids, their allergies improve, asthma. There's lots of things that can happen. And we work with kids with seizures, autism, you name it. And if it's anything to do with the nervous system, we're going to be able to assist that child's body to function better. So this is what we do. We help that kid's body function better with chiropractic care. And if you have a child with this situation, by all means, give us a call if you live locally here in the Hamptons, Southampton. We're at 631-287-3546. If you'd like to visit our website, we're on Facebook as well, Cohen Family Chiropractic. Our website is www.hamptonsfamilychiropractor.com. Check us out. Google us. Do your research. By all means, if you want your child's body to function better, give us a call. Check us out. Have a great day.